Emily. I'm going to be your occupational therapist today. Before we get started, can you please confirm your name and date of birth?
Erica Frank, February 3rd, 1961.
All right, nice to meet you, Mrs. Frank. How are you feeling today?
Okay. Yes.
Okay. Are you in any pain?
No.
No? Well, if you are at any point during the session, just let me know, okay?
Okay.
Before we get started, I'm going to check your vitals. I'm going to check your heart rate, your blood pressure, your respiratory rate, your oxygen levels, and your temperature, and everything is within normal range. All right, so I looked over your charts and noticed that you recently had a kyphoplasty, a surgery for your lumbar compression fracture that you had. So for today, during our intervention, we are going to take into consideration the spinal precautions to keep your spine in alignment to help with the healing, okay? So that means no bending, no lifting over 5 pounds, and no twisting, okay? Can you repeat those precautions back to me just to make sure we're on the same page?
No bending, no twisting, or lifting anything over 5 pounds.
Yes, you got it, and that's just to keep our spine in alignment to help with the healing after your lumbar compression fracture, okay? So what we're going to do is we are going to get you out of bed in a seated position so we can get started for today, okay? All right, so I'm going to move this out of the way. So we are using a technique called log rolling, and this is again just to get you out of bed while keeping those spinal precautions and your spine in neutral as possible. Is it okay if I place my hands on your shoulder and your knee?
Yes.
Okay, so we're going to get started. Go ahead and cross both your arms for me and bend this knee. Okay, and then on the count of 3, I'm going to have you roll towards me, again keeping your spine as neutral as possible. Okay, 1, 2, 3. Okay, now can you push your legs off the bed a little bit? Both legs? Okay, perfect. And then using your core, I'm going to have you go to a seated position, again keeping your spine in neutral. Okay, 1, 2, 3. Okay, now I'm going to lower the bed so your feet are on the floor. Okay, how are you feeling?
Good.
Good? Okay. Okay, so now we are going to practice lower body dressing. We're going to use adaptive equipment. So this is using the rehabilitative frame of reference, and it's just to help you independently perform lower body dressing without your previous maximum assistance, okay? So we're going to use adaptive equipment. This is a reacher. We have a dressing stick or dressing hook, a sock aid, and a long horn or a long handled shoe horn. So what we're going to do first is for lower body dressing, we're going to start with pants. So what we're going to do is I'm going to give you these pants. I'm just going to lay them out like this, and you are going to scrunch up the leg all the way as best you can, again keeping your spine in neutral, so no bending, no lifting, no twisting. Then we use the reacher. So we take the reacher, grip onto the pant leg like that, put it down to the floor, and then put our foot in, okay? You have any questions?
No.
All right, so I'm going to give you this. Good job keeping those spinal precautions. Okay, now I'll give you the reacher. Okay, and you can just go ahead and put your foot in without bending. Good job. No bending. Yeah, I can help you out here. You get a little tricky. And then you can just pull it up with your arms to about right there. Okay, now we'll do the same thing to the other side. Great job keeping those spinal precautions. I know this is all new and you're doing a great job. I'll get this for you. There you go. No bending. Good job. Help you out here. I can get a little step. No bending. Good job. There you go. Perfect. You can leave it right there, and then we'll pull it up later. So next we're going to use the sock aid. So the way it works is you take your sock And then you're gonna put it all the way through the sock aid, like this. Then you're just gonna drop it down, and then you're gonna put your foot in it by pointing like a ballerina, and then you're gonna slide it all the way up, okay? So I'll give you this. And then just kind of point your toe, and then point it down, and then slide all the way up. Perfect. And then I'll have you put the sock in this one. Okay, and then do the same thing. Perfect. All right, so now I think it's time to put our shoes on. I'm gonna move this out of the way. So what I'm gonna have you do to put the shoes on, instead of using the shoehorn, I'm just gonna have you do a figure 4 and put the shoes on like that. Again, keeping those final precautions, no bending, no twisting, and no lifting anything, okay? So can you go ahead and make that figure 4 move with your first foot? There you go, and I'll have you put it on without bending. Perfect. And then same thing to the other side. Okay, so now for our next, the next part of our intervention, we are going to practice toileting. So we are going to use a 3-in-1 commode. This is an adaptive tool to help you regain your independence in toileting. It has handbars, so it makes it really convenient to push on and off so we can keep those final precautions in check, okay? So I'm going to move this out of the way. We're going to get started. So what we do is, to get to the commode, we use a walker. So to do so, you are going to walk at a leisurely pace, keeping your legs in line with the back legs. And you don't need to lift or twist it. And also when we're walking, we don't want to bend or twist, okay? Keeping those final precautions all the way to the commode. Do you have any questions?
No.
Okay. I'm going to place the skate belt around you. This is to provide a little extra protection and support for you and for me, okay, while we walk to the commode. It's gonna fit on you a little snug, is that okay? Okay. You're doing great, Mrs. Frank. How's that feel?
Good.
Okay, then also once we stand up, we get you standing, we're gonna pull your pants up, okay? So can you go ahead and scoot off the edge of the bed just a little bit for me? Perfect. And then on the count of 3, I want you to use both hands and push up as hard as you can. Again, keeping your spine in neutral, no twisting or no bending and no lifting, okay? On the count of 3, 1, 2, 3, push up. Perfect. Okay, you can go ahead and put your pants up without bending. There you go. Okay, so you can go ahead and start walking over to our 3-in-1 commode. Okay, we don't want to twist or bend while we're walking. You're doing great. Doing a great job keeping those spinal precautions in place. Okay, go ahead and turn. You make little scoots without twisting our spine. Keep going. Okay, and then go ahead and back up. Do you feel the back of the commode on your legs?
Mm-hmm.
Okay, and then go ahead and pull your pants down without bending. Good job, you can leave them there. So on the count of 3, I'm gonna have you reach back for the armrest on the commode and then sit down again without bending or twisting your spine, okay? Go ahead and reach back. 1, and then 1, 2, 3. Go ahead and sit. Okay, Mrs. Frank, whenever you're done, just let me know.
Okay.
Okay, so what we do is I'm going to give you this. And for proper toileting hygiene, we always wipe front to back, okay? So go ahead and wipe front to back.
Okay.
All right, no bending. All right, so now what we're going to do is we are going to get you back in bed. So just like what we did to get out of bed onto the walker, we're gonna do the same thing. So I'm gonna have you put both of your hands on the commode armrest, and then on the count of 3, I'm gonna have you push up as hard as you can. Again, keeping those spinal precautions in check, so no bending, no lifting, no twisting. Again, this is just to help your vertebral column heal after your kyphoplasty from your lumbar compression fracture, okay? So what we're gonna do is once you push up all the way, I'm gonna have you grab onto the walker, and then we're gonna pull up, and then you can pull your pants up, and then we are going to walk back to the bed. Okay, do you have any questions?
Yeah.
All right, on the count of 3, go ahead and push up. 1, 2, 3, keeping those spinal precautions. There you go. Okay, so can you go ahead and pull up your pants? Great job. Okay, now whenever you're ready, we're going to start walking back to the edge of the bed. Again, keeping your legs in line with the back of the walker, not bending or twisting your spine. You're doing great. Okay, whenever you're ready, you can go ahead and make small turns without twisting your spine. Okay, now go ahead and back up until you feel the bed behind your legs. Do you feel the bed behind your legs? Okay, and then just like how we sat down on the commode, I'm going to have you do the same thing where you're going to feel the edge of the bed and then slowly sit down without bending or twisting your spine, okay? 1, 2, 3. Go ahead and reach back. There you go, now sit. Okay, how do you feel?
Good.
Feel good? Okay. All right, Mrs. Frank, are you ready to get back in bed? You seem a little fatigued, which is
Yes.
understandable because with your lumbar compression fracture, you've had decreased endurance and increased fatigue. But we're going to continue to work on that and get you back to your previous level of independence, okay?
Okay.
Okay, you're doing great today so far.
Thank you.
Okay, so just like how we put our shoes on, we're going to do that same figure 4 technique where we cross one leg over the other. This again is to help protect your spine while it heals after your surgery. So whenever you're ready, go ahead and cross your leg over. Perfect. Can you go ahead and take your shoe off, or do you need some help?
I think I have
There you go. Good job. You're doing great with the spinal precautions. Okay, good job. Go ahead and relax. Okay, now we're going to use that same log rolling technique to get you back into your lying position. So what I'm going to have you do is you're going to lay on your side, and I'm going to bring your feet up, and then I'll gently place you back onto your back, okay?
Okay.
So go ahead and cross both of your arms. This again is just to help promote your spine so that you don't twist or bend it, okay? And on the count of 3, I'm going to have you just lean onto your shoulder, okay? I'm going to get back here using my proper body mechanics. And 1, 2, 3, lay onto your side. There you go. And then 1, 2, 3. Perfect. Go ahead and relax your legs. How are you feeling?
Good.
Okay, Mrs. Frank. So that's all the time we have for today. I want to quickly go over what we did during this intervention. So to keep your spinal precautions in check, so that means that was no bending, no twisting, and no lifting. This is because you recently had a kyphoplasty due to your lumbar compression fracture. So what we did is we did log rolling, and this was to get you out of bed while keeping your spine in alignment so we weren't breaking precautions. So we used log rolling to get you out of bed to a seated position, to which we then did lower body dressing. This was to help you independently perform the occupation of lower body dressing using a hip kit. So a hip kit is adaptive tools. This includes a sock aid, a dressing stick, a reacher, and a long handled shoe horn. So we use the sock aid and the reacher to get your pants on and your socks on, and then you use the figure 4 motion to put your shoes on. Again, this helped you not break precautions while your vertebral column heals. And these are tools and strategies that you can take once you're discharged back home, so that you can continue to build on those skills, regain your independence and functionality with the lower body dressing as you heal from your lumbar compression fracture. And for lower body dressing, we do pants first, then socks, then shoes, or underwear, then pants, then socks, then shoes. Okay. Do you have any questions with lower body dressing?
No.
No? Okay. After lower body dressing, we use the 3-in-1 commode. And to get to the 3-in-1 commode, we use the walker. Again, the walker was to help support you while you regain your endurance and your strength to get you back to your previous level of mobility. So we use the walker to get you to the 3-in-1 commode. 3-in-1 commode is another great assistive device that you can use once discharged. This helps you regain your independence with toileting. You can push up and use the handlebars on the 3-in-1 commode to sit down and push yourself up, again without breaking those spinal precautions. And then for proper toileting hygiene, we always wipe front to back. Okay? And then we got you back in bed today using the walker to get you back, and you use the figure 4 technique to take your shoes off. Again, the figure 4 technique is a great strategy to use once you are discharged home. It's a great compensatory strategy to use once you're discharged home to get your shoes off, and eventually lower body dress to help with lower body dressing too. So that's an upgrade we can do on our next intervention. And then we got you back into bed using log rolling again, just to keep those spinal precautions in check. Okay? Do you have any questions for me about what we did?
No, I think I'm okay right now.
Okay. How's your pain level?
It's low. It's fine. Thank you.
Okay. So I'm going to quickly check your vitals again. I'm going to check your heart rate, your blood pressure, your temperature, your oxygen levels, and so that was your blood pressure, your oxygen levels, your heart rate, your respiratory rate, and your temperature, and everything is within normal range.
That's good.
Okay, so that's all the time we have for today, Mrs. Frank. I will follow up with you during our next intervention. All right, thank you.
Thank you so much.